Is colon cancer genetic? How to know your risk. Imagine a puzzle where some pieces are inherited from your family, shaping your health in ways you might not even realize. When it comes to colon cancer, genetics can play a significant role. While most cases of colon cancer are sporadic, meaning they happen without a clear inherited cause, about 5 to 15% are linked to inherited genetic syndromes that increase risk. Knowing whether you might carry these genetic factors can help you take proactive steps for your health. One of the most common hereditary causes is Lynch syndrome, also called hereditary non-polyposis colorectal cancer. It accounts for roughly 2% of all colorectal cancer cases. Lynch syndrome results from inherited mutations in genes responsible for repairing DNA errors, such as MLH1, MSH2, MSH6, PMS2, or EpCAM. People with Lynch syndrome have a lifetime risk of developing colorectal cancer as high as 50%. But it's not just the colon. This syndrome also raises the risk for other cancers like endometrial, ovarian, stomach, and small intestine cancers. It is inherited in an autosomal dominant pattern, meaning if one parent carries the mutation, there's a 50% chance it can be passed to each child. Another key genetic condition is familial adenomatous polyposis, or FAP. This syndrome is caused by mutations in the APC gene and leads to the growth of hundreds or even thousands of polyps in the colon and rectum, often starting in childhood or adolescence. If left untreated, nearly all individuals with classic FAP will develop colorectal cancer by age 40. Although FAP accounts for less than 1% of all colorectal cancers, it carries a near 100% risk if no preventive measures are taken. Variants of FAP, like attenuated FAP, involve fewer polyps and later onset, while syndromes like Gardner and Turcott involve additional tumors or brain cancers. FAP is inherited in an autosomal dominant way, so children of affected individuals have a 50% chance of inheriting the mutation. Other genetic factors also influence risk. Muti-associated polyposis is an autosomal recessive condition caused by mutations in the muti gene. It increases colorectal cancer risk but is less common than Lynch syndrome or FAP. Many other genes may contribute to hereditary risk, especially if there is a strong family history of colorectal or related cancers. So, how can you find out if you are at increased risk? Family history is a key clue. If you have relatives who were diagnosed with colorectal cancer, especially at a young age or in multiple family members, that suggests a possible inherited predisposition. Early age of onset, often before 50, is another red flag. The presence of multiple primary colorectal cancers or related cancers like endometrial cancer in your family can also point to a genetic syndrome. Genetic testing is an important tool. If your family history or personal health history suggests a hereditary syndrome, consulting a healthcare professional for genetic counseling and testing can help identify mutations in genes like APC, MLH1, or MSH2. This information can guide your screening plan. People with known genetic syndromes often need earlier and more frequent colonoscopies, sometimes starting in their 20s, and may consider preventive surgeries to lower their risk. Remember, understanding your genetic risk is a powerful step toward protecting your colon health. While genetics can influence risk, lifestyle factors such as a healthy diet, regular exercise, and avoiding smoking also play vital roles. Always discuss your family history and concerns with your healthcare provider. They can help you determine if genetic testing is appropriate and develop a screening plan tailored to your needs. Staying informed and proactive is the best way to support your health and catch any issues early.